What? Just a minute.
So, hello everybody.
Hello.
Good morning, good afternoon.
Good afternoon here.
Okay, I'm Aloysius James and two of my colleagues, Mr. Basu, Vishwanath Basu, Ms. Kartiki Das. Two of my colleagues are here with me to share some of our experiences in working with the basic healthcare support program. We will share how this health program has facilitated changing the power equations and implemented an inclusive health program. I'll give you an overview about the presentation. The presentation gives a brief introduction about the basic healthcare support program, how basic healthcare support program facilitated actually the shifting of the power equations, and also it facilitated an inclusive health program, and the diverse tools which is used in general, some of our learnings, challenges, and the way forward. We look at the context in which we started operating and also putting in the larger context of this conference. We say that, okay, India, a British colony, had inherited the legacy of the Western healthcare laws, rules, systems, and practices. Our leaders have also internalized those values and followed a top-down, urban-based, elite-oriented health program. In India, modern medicine still controls and influences the health policies, completely disregarding the other systems of medicine. Though of late it is different, but still, the biomedical team develops or decides the policies and programs, asks technical experts. This expert team doesn't consider health as a developmental issue and the importance of local governance in health. In the process, the most vulnerable and disadvantaged communities are left out and do not have access to health services or resources. By design, they are not part of the decision-making bodies, which affects their health. A remarkable display of power is visible in the health system, which directly impacts the lives of many members of society, especially those disadvantaged.
Basic Healthcare Support Program is built on a strong partnership and association of more than 20 years with MEMISA, DGD, West Bengal Voluntary Health Association, and various operational and strategic partners in two states of India, namely West Bengal and Sikkim. It's a comprehensive program for a collective action of government and civil society organizations of various levels, from village to national, with technical cooperation from national and international institutions. Basic Healthcare Support Program reaches directly to 1.5 million population from nearly 98 Gram Panchayats from 25 sub-districts in 5 districts in 2 states of India. The program has recognized the importance of intersectoral collaboration between health and other social determinants of health and established such collaboration among Department of Health and Family Welfare, Department of Panchayat and Rural Development, Department of Women and Child Welfare, and Department of Public Health Engineering, and the civil society organizations, and later on with educational institutes and police. The program is all about the local health system strengthening, community empowerment and involvement to ensure availability, accessibility, and affordability to need-based quality healthcare. Shifting power equation, taking and sharing power, thus to empower people towards healthy living. Promoting distributive leaderships and collaborative governance involving both service providers and the service recipients. Working on the broader dimension of health and social determinants of health, ensuring inclusion and accountability of unreached and unserved population. The program has few guiding principles like compass with main approach of people-centeredness, and then linking various actors with a comprehensive approach.
We made an attempt actually to understand how the power is reflected in a health program. And we used the power cube model developed by Mr. John of IDS and the expression of power developed by Lisa and Valerie Miller. And as you see, here you can see the power cube model, which talks about the forms of power actually. There are visible powers, hidden powers, and invisible powers. We try to understand what are those things in the health sector. We also try to understand actually the spaces available, which are the closed spaces actually, where there is an entry. Or do we get an invitation, invited spaces are there? Or claimed or created space. And these are the spaces we try to create, or we try to check the boundaries. And at the another level, we also have these levels, which starting with the local level, to the national, to the global, at different levels. We also looked at the model developed by Lisa and Valerie, the expressions of power, which is a very common framework at the moment everybody is using around when we look at power. The power within, the power with, the power to, and power over part of it actually. And when we started looking at the expressions as well as actually probably the power cube model, we also realized that multiple layers and levels of power are also visible in our health context. As you know, health is very complex and dependent on many sectors which are linked and connected. We have healthcare institutions and teams at different levels. They are connected to local governance institutions or other development institutions established by the government. These institutions start at the village level and report to the sub-district, district and state level bodies. Besides, we can see various ministries and departments of the state and national government, primarily making policies, plans, allocate resources, and oversee the functioning of these institutions, which are seen from the village to the top level. Besides, we have the civil society organizations who are more concerned about the people's empowerment, service provision, which includes the CBOs, community-based organizations, self-help groups, and the private health players, which are mostly profit-oriented or non-profit oriented. And also the existing practicing indigenous practitioners. They also practice other systems of medicines, which are not part of the mainstream health system. The political parties, they play a critical role in linking these groups and actors. And probably their policies. That gives actually the power, whether to the people or to the institutions or at a different level. And we also try to understand the different expressions. And in that context, it is basically helping the people to recognize, claim, and exercise their power. As you see it we have three actors, the state, civil society, and communities. And we have the four framework, the power with, power within, power to, and power over. Initially, we were not clear on how the power is operated in the health sector, but our continuous association and interaction with the different actors provided us insights into the power dynamics and how to work with it and how to make shifts that needs to change the power. The health actors are always kept on the pedestal by the society, by nature. And people often, they do not recognize these rights or ignore them when it is denied. Because that is not an important thing for them. The services or the policies often directed from the top without considering their health needs and the socio-political or economical context of the community or the people who they live. And when we started our working, we also realized that many of our program areas, they needed mere basic facilities, whether it is in terms of health, whether it is in terms of agriculture or water, sanitation, or health, or probably the housing. What we did is we started with the communities, civil society, and later associated with the state. We mobilized and organized the community, linked them with the government systems, and the civil society groups, they accompanied them. The process helped people to recognize the power within, to appreciate their self-worth and dignity. Our facilitation enabled the community to recognize their rights and enable them to dialogue with the authorities and their demands. We supported them in establishing platforms or spaces wherein they have a say, or help them to be part of available forums at the local village level, or at the governance level, or at the sub-district or district level, where they can articulate their needs, challenge the actions taken for them, or demand better services as per the policy, or make a shift in the policy itself, actually, change the policies. These empowered communities negotiated with the ANMs, that is the auxiliary nurse and midwife, the doctors, ICDS, integrated child development groups, their leaders, the local governance bodies, or the higher officials of whatever sector, whichever department they belong to it, actually, but through this forum. They networked and collaborated with the similar forums, other stakeholders, exercised their power with their help. The forum and networks multiplied their capacity to challenge, partner, or negotiate with those in power. The process allowed them to be part of the decision-making bodies or to influence the policies or their operational aspects. And this is practically what happened when they started looking at all these four dimensions, actually.
This is all about the inclusiveness, to identify the people who are excluded from the services of government, various services. It's not exclusion, it's something like they never included them in the program. From the very inception of the program, one thing was fixed, that those who were deprived of various services due to various reasons should also be included in the program. It could be something that the services are not available near them. They are a bit hesitant to come for the service. They are not comfortable with the service providers, or they don't get proper attention, and many more other things. Such populations are the people with any form of disability, women and children, the elderly people, the adolescents, mainly the girls, never had the scope of going to schools or any health facilities, or maybe had an early marriage. Then people living with HIV/AIDS, people living in unreachable and underserved areas, mainly the islands and the hilly areas. And there are minority groups in terms of religion and ethnicity. The strategy of the program was to recognition of diversity of the population and their health needs, ensuring participation in decision making, like participating, facilitating, or influencing in various decision making process as one of the active stakeholders. There are some space created for them. It could be called as a community platform. It could be called as a health forum, people's forum. Then there was a question of removal of barriers. It needed identifying the barriers and find ways to overcome. And then we made some tailored program, issue-based approach, focus on socially excluded communities.
The basic healthcare program experiences complex scenario in the field. The social changes pathways are not non-linear and unpredictable. The needs to be analyzed constantly, like action, reflection, and action process. Both qualitative and quantitative tools are used in the program at various stages. The tools are mind shift, case stories, community scorecard, interface meeting, and rich picture, etc. Rich picture is a pictorial presentation of problem situation. It helps the participant to understand the complexity of the entire situation, which is developed by interview community. Interface meeting is also a powerful tool. This process helps the government senior officials to make decisions to improve services. If you are interested on the tools, you can go through our story and image book, 20 years experiences working with local health system, which was published in 2022. The book covers concept, theories, principles, frameworks, process, tools, stories of success and failures, and the books are available online.
Quickly reflecting on some of the learnings and challenges, but a lot of learnings and challenges are there. But I just wanted to look at some of the things. Of course, the change is very complex and needs a comprehensive and flexible approach. Because we need to be more flexible and adaptive. But I'm just picking up 2-3 things. The whole question of power analysis, that is very tricky one actually when we start the process. It's very complex and also very challenging to comprehend when we are there in the beginning. And it takes time actually. It takes time, and also we need to go deeper also, especially to understand the power structures actually. There are hidden powers, there are visible ones, and which are the places where we have spaces. The other dimension is confronting the local power structures. That's not easy because already established, and you are challenging them. And your people, the community, they are not willing to make any challenges, any step forward. So continuous coaching, it's something like an action reflection process. We also need to be with them, accompanying them, giving them confidence, capacities, and also maybe reflection action process is also required. So it is an incremental process, and you don't expect a radical change overnight. And when we talk about inclusion means there are certain groups that are excluded because they don't have the power. So inclusion means you are challenging the power so that the excluded people, they get power and they are getting back. All are inside actually, are safe, all are healthy. So that is not that easy at the moment. And we were also working with actually the various partners and networks, NGOs. We found that there are also power dynamics, power equations happening within our own setup. The power structures within our NGO community that has been sometimes challenging. So it reduces probably the quality sometimes when there are tensions, or lessen the pace of our program. Because then we need to take a break and then we need to look at those issues, address it, then we need to move forward. So again, a slow process. Working with the government is not that easy. And finally, moving forward, what is the way forward? See,
Basically-
yeah, please.
Basic Healthcare Support Program is a people-centered program which is coordinated by local CBOs and community groups and individuals to work together as a health forum. The community empowerment process provided opportunity for People's Forum to raise voices. The multi-stakeholder dynamics are developed to strengthen the local health system by People's Forum. People's Forum addresses need-based and issue-based responses, promoting and supporting collaborative governance model for local health system strengthening, and the learning experience and documents should be shared with the broader community.
This is in nutshell about us, our program. Thank you very much.
Thank you.
Thank you.